Government of India has made a couple of important decisions with regards to India's fight against COVID. Remember, the Prime Minister met with the Chief Ministers to discuss the new COVID strategy, to take stock of the ground situation. And after that meeting, the news has come that there can be a possibility of reducing the gap between the last vaccine dose and the booster dose. So whichever vaccine you would have taken, the current gap is supposed to be 9 months, which might be reduced to 6 months. This has been taken, this decision is likely to be announced on the 29th of this month, so 29th of April, by the National Technical Advisory Group, that is the NTAGI, National Technical Advisory Group on Immunization. Now, what is important here is that this decision comes after an understanding of the fact that the effect of the vaccine starts waning after 6 months and people become vulnerable. At this stage, the country cannot afford to be in a situation where bulk of the population becomes vulnerable again to COVID-19. Therefore, this decision is likely to come. That is the important development that we are tracking. The second big decision, of course, that has come is with regards to vaccine for children. As many as 3 new vaccines have been introduced: COVAXIN, CORBEVAX and ZYCOV-D. These vaccines are for children between the age group of 5 to 12. So the idea is now to also ensure to immunize children so that they don't remain vulnerable. They can be carriers. This is an immediate step that was required to arrest the spread of the disease. So the focus again is vaccination for children, and now, as we understand, for adults as well, the gap for booster has been reduced. There are at least 3 challenges that the country is still facing with regards to its fight against COVID. The first is again the complacency setting in. As we all know, many states have lifted the mask mandate. In Maharashtra, for instance, in Mumbai, if you look around, you will see that people have stopped wearing masks. Now, this can be a dangerous trend given the fact that the daily increase in cases have gone up above 2,500. So, in Delhi, particularly contributing to bulk of this number of daily new cases, there the mask mandate has been reimposed. It is likely that it will be reimposed in Mumbai and Maharashtra as well. That challenge here again is that people have started lowering their guard. The second important challenge that the country is facing is with regards to kids vaccination. The turnout to get the jabs for children is much below expectation. So parents are not coming out in big numbers to get their kids inoculated, something that must be addressed, especially now that you have a wide range of vaccines approved by the Drugs Controller General of India. The third important challenge again is testing, which has obviously dipped substantially. So the alertness of the authorities to continue testing is sort of taking a beating at the moment. That needs to pick up. Unless we test, we will not know what is the spread of the infection. Therefore, in the meeting, the Prime Minister's review meeting with the Chief Ministers, it was emphasized that the 3 T's, tracking, testing and tracing, will be back on the agenda. The states have been advised to whip up efforts in this regard so that there is no lackluster attitude when it comes to finding out the level and extent of the spread of the infection so that it can be arrested at a very early stage.